AI predicts the development of bipolar disorder or schizophrenia. Welcome to the official GlobalRPh YouTube channel. If you haven't already, hit that subscribe button to stay updated with our latest videos. Whether you're looking for medical insights, the latest healthcare trends, or fun educational content, there's something here for you. Abstract. This video examines recent developments in artificial intelligence, AI, for forecasting the onset of bipolar disorder and schizophrenia. It examines the most recent data on AI-based prediction models, their precision, and potential medical applications. The study emphasizes how critical it is to identify mental health issues early and take appropriate action. It also goes over ethical issues, future research directions, and the advantages and disadvantages of AI in psychiatry. The goal of this review is to give medical professionals a thorough grasp of how AI can be used to predict serious mental illnesses. Introduction. Bipolar disorder and schizophrenia have a significant influence on people's lives and society as a whole. Improving patient outcomes and quality of life requires early detection and intervention. Advances in artificial intelligence have shown promise in predicting the development of these disorders before the onset of clinical symptoms. This study examines the current status of AI-based prediction models for bipolar disorder and schizophrenia, as well as the potential advantages and challenges of implementing them in clinical practice. AI-based prediction models, machine learning algorithms. Several machine learning algorithms have been used in recent research to forecast when bipolar disorder and schizophrenia will manifest. Large patient datasets, including genetic markers, neuroimaging results, cognitive tests, and clinical history, are analyzed by these algorithms. These prediction models frequently employ the following machine learning techniques. SVMs, support vector machines. SVMs function by defining boundaries between different sets of data, such as distinguishing between patients who are likely to acquire a condition and those who are not. They excel at handling high-dimensional data, such as genetic profiles or imaging features, where patterns are often complex for humans to discern. Random forests. Random forests function as a team of decision-makers, with each tree in the forest making its prediction based on various characteristics of the data. These individual predictions are then aggregated to provide a final decision, which is frequently more accurate and dependable than any single tree. This strategy is advantageous when dealing with complex, noisy data, and it can also identify which factors, such as specific symptoms or test results, are most relevant in predicting who is at risk of acquiring a mental health disorder. Deep neural networks, DNNs, are based on the way the human brain works. They are made up of several layers that extract deeper insights from data over time. They are especially effective for complex data, such as brain scans, in identifying subtle patterns that other approaches may overlook. However, they require vast datasets and computer capacity to perform properly. Gradient boosting machines. GBMs construct models in a step-by-step process, with each new model attempting to fix the errors of the prior one. It makes them highly accurate and versatile. They're frequently utilized when precision is required, such as anticipating the early stages of mental health deterioration. These algorithms identify people who are at a high risk of developing bipolar disorder or schizophrenia by identifying patterns in the data that are currently available. Features and data sources. To increase accuracy, AI prediction models use a variety of data sources. Among the salient characteristics employed in these models are genetic data. Certain gene variations are linked to an elevated risk of schizophrenia and bipolar disorder. Neuroimaging information. Abnormalities in brain structure and function are seen in neuroimaging scans. Cognitive evaluations. Results on tests of executive function, memory, and attention. Medical background. History of substance abuse, childhood trauma, and mental illness in the family. Social and environmental factors. Living conditions, social support, and stress levels are examples of social and environmental factors incorporated into these prediction models. AI models can produce a more thorough risk profile for every person by integrating these diverse data sources. Model accuracy and performance. The accuracy of AI-based prediction models has shown encouraging results in recent studies. For instance, a study by Smith and others in 2022 found that they could predict the onset of schizophrenia within 2 years with an accuracy of 85%. In a similar vein, researchers in 2023 used a deep learning model to predict the progression of bipolar disorder with an accuracy of 82%. It's crucial to remember that these findings are derived from controlled research involving particular populations. The actual performance of these models may differ and requires further testing in various clinical contexts. Applications in clinical practice. Strategies for early intervention. Predicting the onset of bipolar disorder or schizophrenia creates new opportunities for early intervention. Medical practitioners can use these forecasts to launch focused preventive initiatives and provide high-risk individuals with more attentive supervision and assistance. They can also be used to start treatment as soon as possible. It can help postpone or stop the onset of severe disorders. Cognitive behavioral therapy, stress reduction methods, and, in certain situations, low-dose medication to control early symptoms are examples of early interventions. Stratification of risk. Clinicians can stratify patients according to their risk levels with the aid of AI prediction models. Due to this stratification, healthcare resources can be allocated more effectively, ensuring that high-risk individuals receive more intensive monitoring and support. Tailored therapy programs. AI models can help create individualized treatment plans by analyzing various factors that contribute to an individual's risk. To better customize interventions, these strategies might consider individual traits, environmental influences, and genetic predispositions. Ethical issues and difficulties. Data security and privacy. There are serious privacy issues with using AI to predict mental health conditions. Healthcare providers are required to ensure that patient data is stored and used safely in accordance with applicable laws, such as the Health Insurance Portability and Accountability Act in the U.S. Labeling and stigma. Unintentional stigmatization could result from predicting the likelihood of severe mental illnesses. It's critical to respond to these predictions with tact and refrain from assigning labels to people that could harm their social interactions or sense of self. False positive and negative results. AI models are not flawless despite their encouraging accuracy. While false negatives could result in lost opportunities for early intervention, false positives could cause needless anxiety and potentially harmful interventions. These forecasts are just one of many tools that clinicians must use when making decisions. Explainability and interpretability. Many sophisticated AI models, particularly deep learning algorithms, operate as black boxes, making it challenging to understand how they generate their predictions. For these models to be accepted and used effectively in clinical practice, their interpretability must be improved. Prospects for the future. Electronic health record integration. The integration of AI prediction models with current electronic health record systems should be the primary focus of future research. Real-time risk assessments based on continuously updated patient data would be possible thanks to this integration. Longitudinal studies. The efficacy of AI-guided early interventions in preventing or postponing the onset of bipolar disorder and schizophrenia requires longer-term research. Multimodal methods. The accuracy and resilience of prediction models can be further enhanced by combining various data types, such as genetic information, neuroimaging, and digital phenotyping, such as smartphone usage patterns. Standardization and guidelines. Standardized protocols for the creation, verification, and clinical application of AI prediction models are required as they proliferate. The development of these guidelines should be spearheaded by professional associations in the fields of mental health and psychiatry. Conclusion. AI-based prediction models for bipolar disorder and schizophrenia hold a lot of promise for facilitating early identification and treatment. These tools could significantly enhance both patient outcomes and the distribution of resources in mental health care. Ongoing research, thorough validation, and ethical considerations must, however, direct their application. AI will likely become increasingly significant in mental health care as it continues to develop, enhancing our ability to offer individualized, preventive treatment for severe mental illnesses and bolstering clinical expertise. Thanks for watching our GlobalRPh production. If you enjoyed the video and found it helpful, don't forget to smash that like button and subscribe to our brand new YouTube channel. We're bringing you a dynamic mix of content across a variety of topics, so there's always something fresh, engaging, and insightful just for you.